everyone, this is Rachel and I'm going to be your instructor today for this class, and I'm so excited to share with you some of the amazing things to look forward to when you have your baby. I know that it can be a little daunting, all of the information that's out there, so I'm so excited to be able to share with you some of the things that I've learned. I've been a maternity nurse for about 8 years now. I've worked labor and delivery, postpartum, even NICU, nursery, so I know a little bit of everything, and this class is basically just different questions that I've had throughout the years from patients of mine, from clients as well who are delivering babies expecting, and some of the questions that they've had. I just thought it would be great to be able to share with all of you guys. So for today's class, I'm going to be using my class as kind of a format as well. I do have an online class here. So if you go to mommydidyouknow.com, you go to course login, you'll be able to log into your courses. And this is one of the courses that I have. It's a prenatal crash course. It goes over a little of everything that is to know about childbirth and preparing for your baby, even from pain relief, vaginal delivery, C-section. So for today, for free, I just wanted to give you a little bit of a preview of what to expect and obviously go over some amazing information. So this is going to have some secrets that I've learned throughout the years and just different things to help you and your family make your life a little bit easier. So first off, this class is going to be divided into 4 different parts. It's going to be pregnancy, labor and delivery, postpartum care, and then newborn care. So some really important questions that people had throughout each of those topics. So my first question is obviously going to be pregnancy. And I just wanted to talk about different things to expect during your pregnancy and different ways to be able to make your life a little bit better, a little more comfortable. The first trimester, usually you're going to have a little bit of morning sickness, some frequent urination too, heartburn, constipation, all of those great things to look forward to. Morning sickness, what really helped me was actually sucking on a lemon. There's so many different things that you can do, but sucking on a lemon helps to also eat some saltines. You can try smaller meals throughout the day. Try not to have so much grease as well. If you have a lot of things that have grease, sometimes it can make your morning sickness even worse. And sometimes you want to avoid those foods that make you a little bit more nauseous as well. For the urination, you can try to empty your bladder before you go to sleep. You can try also not to hold it as well, because if you hold it, you can get urinary tract infections, which are pretty common when you have a baby as well. When you're pregnant, urinary tract infections can be pretty common. And if you do have a UTI that gets pretty bad, it can even cause a premature delivery, premature birth. So you definitely want to stay away from that. Second trimester, usually you'll start to get a little bit more energy, and especially as the baby starts, you'll feel the baby's movement. It's usually the second wind you'll feel in that second trimester. One of the biggest issues that I see during the second trimester is aching back and pelvis. I notice that a lot from my patients or from my clients as well, who's taking my prenatal coaching classes or just my regular online classes as well. They say, what can I do for my aching back? I could barely move. I remember, especially during my second trimester, as a postpartum nurse, I have to do fundal checks. What I would notice was I would bend down to do fundal checks and I would get this sharp pain all up and down my side. That is sciatica. And also I would have a lot of pain in my back. So what really helped me was packs for my back, like heat packs for my back. If you do have a lot of abdominal pain, it's not good to put a heat pack directly on your abdomen. What you can do is have a nice warm bath, or you can even use some of those abdominal binders. They have a lot of those support bands that you can use during pregnancy, and then that really helps as well. Another thing that I noticed that sometimes women have in their second trimester is nasal congestion. So nasal congestion is going to happen with all of the difference of the hormones and everything that's going through your body. So if you are somebody that's dealing with nasal congestion, what can really help with that is not to take saline nose sprays and those Afrin nose sprays. Not to have Afrin nose sprays, but instead try more saline nose sprays. Always consult with your physician before, but that really helps. Try also to stay clear of allergens if you feel like the allergen might be causing your nasal congestion, and that can help you as well. Third trimester, of course, the baby's getting a little bit closer. You'll be all excited about your new baby. what really helps for some of the issues in the third trimester, one thing that I noticed is a lot of moms have varicose veins. So compression stockings will help a lot with those. You can get really nice ones on Amazon too. You can try, if you can, limit the amount that you're walking or limit the amount that you're staying standing for long periods of time. And sometimes just to know, sometimes it just happens for whatever reason. Sometimes you might have varicose veins. It runs in your family. It runs in my family, but I was able to avoid some of them. You also, a big thing that people ask me about are stretch marks. And what do I do for stretch marks? So keep in mind, stretch marks, they're bound to happen. Your skin is going to be stretching. Some people, they have no stretch marks at all. Other people have a lot of stretch marks. So it really depends on your genetics for one, and then obviously how big you're getting. You're having twins, triplets, or man, sometimes even more than that. You would expect to have a little bit more stretch marks. But try a cocoa butter. Cocoa butter really works for stretch marks. Try not to itch it too much as well. I notice sometimes as your belly starts to stretch, you might get a lot of itching, and I had a lot of itching with my babies. But try not to itch it too much, or if you do itch it, try to use like a towel instead, so that sometimes your nails make it a lot worse. So then by using like a towel or something else instead, that will really help to kind of keep the stretch marks at bay. And then we did talk a little bit about those. And then here are just some more issues during pregnancy and how to kind of battle it. So the first one is nausea. So nausea is something I know a lot about, especially with my first pregnancy. Oh man, I remember my nausea was awful, and I had it my whole pregnancy from the beginning to the end. Now, there are a lot of holistic ways to deal with nausea. Of course, if it gets really bad, you can always ask your physician for a prescription. For me, what helped was eating ginger, drinking ginger tea, especially what I did for ginger tea. It's kind of a nursing trick. So this is our first kind of nursing secret that we do. And ginger tea helps not only with the nausea, but it even helps if you're feeling constipated, or I give it to my patients if they're having trouble peeing that first time after getting that catheter out. So all you do is you take some ginger ale, put it in the microwave for about a minute, and then you put a tea bag inside. That is such an amazing way to deal with nausea. And then another thing I do is if they're dealing with constipation, I will add some prune juice inside. So it's called the poo-poo bomb pretty much. And you can take some ginger, like ginger ale, put some prune juice inside. If it's a little too bitter for you, you can put some cranberry juice and then a little tea bag. And then that will help you if you're dealing with constipation, even before or after pregnancy, and it works so great. You can also try peppermint aromatherapy and teas. They work a lot with nausea. And control your breathing, in through your nose, out through your mouth. I know sometimes you feel like you have to vomit. Sometimes it's so bad when you have nausea, but in through your mouth, well, in through your nose, out through your mouth. You can try to pick a focal point. It could be like a spot on the wall. It can be a person. It can be even a clock, whatever that is, that focal point. Breathe in through your nose, out through your mouth. Sliced lemons work amazing. I mentioned it a little bit. But what I would do is, even if I was, let's say I was giving report in the morning, I would literally have sliced lemons and then suck on it as I was giving report. Especially my first baby, I worked night shift. So I would take the lemons, suck on it, I'm giving report, and that helped me so much. You can have multivitamins like B6. That is one of the best remedies that really works. So if all of these other holistic things are not working, you can always try vitamin B6. That is one of the best ways that you can try. And then if that's not working, you can always ask your physician for something as well, for a prescription. It's always better to just ask your physician for something, but if instead of just taking it over the counter, it's good to get a prescription, and usually they can have some insight that you might not have known about before. Another one is fatigue. So of course, as you progress through your pregnancy, you're gonna be tired. You have a tiny human in there after all. So one thing is try to drink a lot of water. You can try to exercise, take a walk, listen to music, and get your iron levels checked, because sometimes fatigue can happen if you have low iron levels or anemia. So if your hemoglobin levels are low, because your hemoglobin is what carries the oxygen. So if it's too low, then sometimes it might cause you to be a little fatigued. Another one is watch your diet, cut out those fast foods, cut out those caffeine, and rest when you can. I know it's sometimes so hard, but rest when you can. Another one, we have heartburn, we talked about sciatica, insomnia, so a little bit of everything. So this class, by the way, if you go to courses and childbirth class, that's the class that we're using here as kind of the base of what we're talking about. So you have so much more information here. Now, for pregnancy, I have more information like understanding your prenatal appointments, prenatal complications, even preparing for delivery. So I wanted to go over a little bit about how to prepare for delivery. So one thing, so you're going through your pregnancy, you have your support people. Now you're starting to get a little bit closer to your due date, and you're like, all right, how do I prep for my delivery? How do I get ready for my baby to come into the world? You know, you have so many different questions, whether it's how to assign, you know, your furniture in your nursery, how to prep your hospital bag. So that's what we're going to talk about right now. So number one is remember the power of your words. The first step of preparation is always the mental start of preparation. So you're going to remember the power of your words. You're going to try to have positive friends, positive mentality. Try not to have friends next to you that are going to speak negative thoughts into your life and negative words into your life. Have a positive support system as you progress through this pregnancy, as you progress through your labor. And it makes such a great impact. So I see this all the time when I come in, let's say I come into a patient's room, they're holding their baby, and the first thing I see is, oh, I can't do this, I can't do this, and they start nodding their head. Remember the power of your words. Yes, you can do this, you can do this. You are a powerful woman, and remember the ability that your words have on your body. So make sure that you have positive words even from the time that you're pregnant, so that when your baby finally does come, instead of having these negative thoughts, you're having words of encouragement and you're having thoughts of hope instead. And then number two is don't neglect what gives you joy. Start this during pregnancy. You know, if you love music, listen to music. If you go to church, keep going to church. If you're a member of a book club, keep reading those books. You know, whatever gives you joy, keep doing that during pregnancy, keep doing that after as well. Try to the best of your ability. I know it's a little difficult when you first have a baby to, you know, keep active in the things that you were active in, but try to the best of your ability to at least have a little bit of joy. I know with my first, for example, I didn't really realize the impact that having a new baby would have on my relationship with my friends, with my family. And I actually ended up getting a little bit of postpartum depression just because of you know, before I would go to church all the time. I would be interactive. I loved the music that was in my church. I would love the praise and worship. And then all of a sudden I have a new baby and I'm holding this baby in the middle of church and I can't I can't do anything. I can't go to the front. I can't go to the altar. You know, there were so many things I wanted to do. So I remember that I had a friend, she came up to me. I didn't even ask for anything. She came up to me and she said, oh, I want to hold your baby for a little bit. So, because I can see that you really want to, you want to pray. And for me, that just broke down so many walls. And then it gave me a huge realization that's what was causing my postpartum depression. It was the fact that the things that gave me joy, I felt like I was not able to participate in those things anymore. So for me, it was church. For you, it can be music. You can be part of a band. It could be book club. It could be this friend that you're always close with. So try to make a plan now while you're pregnant, so that when the baby does come, that you don't feel so left out. You don't feel like those dynamics are changing so much. And keep your support system close. Make a plan. Try to think of when you would want your family to visit so that you can let them know ahead of time. Some people want to wait a little bit. Some people are fine like right after or even during. You know, everybody's different, but come up with a plan beforehand and make your wishes known, you know, especially to your support people. Now you're getting closer to delivery, and I want to go over the signs and stages of labor. So a lot of people, they have a hard time distinguishing false labor and true labor, where they have kind of issues knowing when, especially when to go to the hospital is what I'm saying. A lot of people have some issues with that. So some signs of labor, and this will help to kind of figure out if this is true labor or false labor. And this is something that I recommend to a lot of my patients as well. So true labor is characterized by a few things. One of them might be lightening. So as your baby starts moving closer, more down in the pelvic area, you're going to start feeling intense pressure on the bladder. It does not mean that your delivery is going to come right now, but it does definitely makes that your labor is at least heading in the right direction. You also might even have a little bloody show or a mucus plug. That does not, yet again, does not mean that your delivery is coming right now, but it does mean that your body is prepping. Now, as a nurse, like heading into labor and delivery, by the way, just a little tip on this too, we are more concerned if you, let's say, rather than lose your mucus plug, we're more concerned about if your water breaks. So if you go to the hospital and you just lost your mucus plug, they might note it, but it's not as I guess you would say important for notes as much as if your water breaks. If your water breaks, we're like, all right, okay, we definitely know that she is heading into labor, even especially if it's premature labor. If your water does break, you want to keep tabs on the color of it and the odor of it and the time. So you want to know the time your water broke. You want to know the color of your water. It should be clear, but if it has a different color, you want to make sure to let your doctor know, especially if it is a darker tinge color or a black color or even a green color. You want to make sure to let us know, because that can be a sign of respiratory distress or distress in your baby. Because sometimes that's called a meconium stained fluid. That can mean that your baby is in some form of distress. So if your color is different than clear, make sure that you know it. And also if it has a foul odor, definitely make sure that we know that it had a foul odor, especially if you have a premature baby or if you have a fever, because foul odor can go in the kind of realm of choreo or of infection, and we want to make sure we know that. So if the amniotic fluid has a different color, that can mean distress. If it has a different smell, that can mean infection. So those are just certain things we're looking for. Nesting instinct, also before your baby comes, you're going to be like hopping all around the house. So just different signs of labor. We have lightning, bloody show, nesting instinct, your water breaking. Now, the difference between Braxton Hicks and regular is that regular contractions, true labor, is more regular and it's more intense. So if you look at your head and you look at your chin, you look at your nose and you look at your forehead, all right? You look at your nose, chin, forehead. Your nose is a mild contraction. So if, like, let's say you feel your tummy and in the middle of the contraction, you feel your tummy. If you feel like it is like your nose and, you know, it's kind of soft, but a little bit tight, but it's soft, you know, that's a mild contraction. If you feel like it's like your chin, where it's definitely much tighter than before, a little soft, but definitely tighter, that is a moderate contraction. And if you feel your forehead, where it's very tight, it's very hard, that is a more heavy contraction. So you know that you're definitely getting closer. So we have intense contractions. We have regular contractions as well. Normally, for labor to be progressing, we're looking for your contractions to be about every 3 to 5 minutes. That even is included if you're natural or if you are having an induction or an augmentation. The difference between an induction and augmentation is that in induction is we are kind of ripening your cervix a little bit, making it a little softer first. Augmentation means that your body has already started and we're just helping along the process with maybe some Pitocin. So whether it's an augmentation, an induction, or true labor, usually we'll want your contractions to be about every 3 to 5 minutes. And then especially when you're getting into like true labor transitioning, it's normally about every 2 minutes. It even starts getting closer. So once you start getting about every 3 to 5 minutes for about even 30 to 45 seconds, and okay, man, I'm heading into true labor, let's get to the hospital. Keep in mind, you want to head to the hospital sooner if you have any risk factors, such as if your water breaks and has a weird color, or if you are GBS positive or anything like that. Now we have labor. So we are in labor. We talked about pregnancy. Now we're going to talk about the stages of labor. Now, the first stage of labor is early labor to full dilation. All right, so this is going to be latent, active and transition. That's between 0 to 10 centimeters. So that is when your cervix is going to be dilating. So as you are going through these different stages of labor, the first one is from early labor to full dilation. Early labor is usually when we will send you home, excuse me. That is usually when you're starting, but you're not really in active labor. Usually when you're about 4 to 7 is when we will admit you. By 8 to 10, that's when we're saying, all right, the baby's going to be coming pretty shortly. Stage 2 is pushing. It normally lasts about 30 minutes, but sometimes it can last longer. Of course, if it's your first baby, you might be pushing a little bit longer. What you want to do is when you're pushing, make sure that you are not pushing with just the vaginal area, but you are also using your abdomen to push a little bit as well. So it's kind of like you're going to feel like you have to poop. It is the funniest thing, but you are going to feel like you have to poop, and you might even poop before you have your baby. It's not a big deal. We see it all the time. So don't be concerned about that. So we have the stage 1 is the early labor to full dilation. Stage 2 is pushing. Stage 3 is the delivery of the placenta. So keep in mind, once the baby's out, you're like, all right, now I got to get this placenta out. So stage 3 is the delivery of the placenta and all of those extra parts. So usually the placenta, you're still going to have a little bit of contractions as the placenta comes out. And then if the placenta stays attached, it might have to be manually extracted by the doctor in order to avoid hemorrhage, because all that placenta has to come out. And then stage 4 is the golden hour. Although I like to say the golden period more than the golden hour. If you've taken my breastfeeding classes, you know, if you think that this childbirth class is informative, just wait until you see the breastfeeding classes. The breastfeeding classes are going to blow your mind. But the golden hour is that first period after the baby's born, where you want to start skin to skin and you want to try to breastfeed. I say the golden period, thinking in the terms of a nursery nurse. So sometimes I am in labor and delivery and I'm the nursery nurse. I'm transitioning the baby after birth. Now, as a transition nurse, we are considering the period of at least 4 hours to be that transition period. So if my transition period is at least 4 hours, why are we only considering that golden hour to be the first hour of life? Why aren't we doing skin to skin longer, or even for that entire transition period? So I'm just going to throw this out to you, and of course you guys can do whatever you want, but you can even do skin to skin as long as you can. And research shows that even if you do skin to skin and breastfeed on and off for the first, not even hour, but 4 hours, that first golden period, it increases your success of breastfeeding, and it even helps the baby to transition better. Because skin to skin releases a lot of the extra demands off of the baby, and it helps instead allow mommy to control the temperature, for example, so that baby can spend all of that extra glucose to breastfeed better and to transition better and do all of those changes that occurs in those first few hours. So once babies are born, they're first active for about 1 to 4 hours, hence the important time for the golden period. Then they hibernate for a little bit. So you might even notice that they'll hibernate for about 12 to 24 hours. That's when you want to wake them up. You have to change their diaper. You want to put them skin to skin. You can even do a little infant massage and feed them every 2 to 3 hours. You want to wake them up, even overnight, okay? Usually, by the way, just a little tidbit, newborns, they tend not to want to wait more than 4 hours without a feeding, because if it's over 4 hours, they start to metabolize their glucose. That's how they can end up getting hypoglycemic. Now, hospital bag. Now, there's more information about this in my class as well, but for hospital bag, for you, think of comfort. Think of comfy blankets. Think of comfy pillows. Think of chargers, long chargers that you don't have to like reach across the room to get your cell phone. Think of, comfort. Try to get your prenatal records if you can. That's another big thing, is especially some doctors do not send your prenatal records as much as you would think. So then if you don't want to have those extra labs and extra tests, get your prenatal records in there. Try to bring whatever pillow, whatever blanket, whatever music you like, comfy robes. That really helps. For baby, bring your car seat. You don't have to bring the car seat inside the hospital unless your baby is premature. But you can even, sometimes what I'll say to especially my first time parents is, if you want, bring the car seat in, adjust it to the baby, and then bring the car seat back out. That way, when you leave, the car seat's already set. You can try a noise maker, especially white noise. Never try to breastfeed a baby when they're crying, because if they're crying and you put them to the breast, what's going to end up happening is they're going to start refusing the breast, and it's going to create this negative association to the breast. So by having some nice white noise, some skin to skin, it will help calm the baby down first so that you can have a nice breastfeeding session. You can try swaddle blankets. In my class, I have a whole video on how to swaddle the baby. If you even have the live consultations with me as well, I go over how to swaddle. Even if it's a Zoom consultation, if I do prenatal Zoom consultations as well, you can always either call me or send me an email, and I would love to go over it with you. I do a whole baby care instruction with the parents. Know your pediatrician. Know also the pediatricians, what they do in terms of vaccination. So some pediatricians will, for example, not take you if you don't have certain vaccinations. So those will be certain things that you would want to talk about beforehand. Baby clothes. The hospital usually does provide clothes for both mom and baby. But let's be honest, you probably prefer your own, and it's better to get out of that, hospital gown, and it's better to get out of the hospital clothes and use your own, especially if you're, taking pictures and all that good stuff. A baby blanket, at least one to take your baby home, so at least you can take that. And then just make sure that blankets are not too thick, not too fuzzy. So your partner is there to help you. Keep in mind that some hospitals' visitation policies have changed this year because of COVID and everything like that. So keep in mind that if your partner cannot leave and come back, right now in our hospital, they can leave and come back, but just in case they can't, try to bring some clothes for about 2 to 3 days, lots of snacks and water, toiletries for them as well, and entertainment. So one really cool kind of nursing secret is, mom, by the way, you guys can bring like an air mattress, usually even like a small air mattress if the hospital does not provide dad a bed, because sometimes they just have a little recliner. So you can have an air mattress for comfort. You can even have, let's say for entertainment, like one of those Amazon Fire Sticks or a PlayStation, if you want to watch some TV, because sometimes the hotspots are not that great, or the Wi-Fi is not that great, but I noticed that even the Amazon Fire Sticks work better than having the Wi-Fi and streaming it straight through the computer. I'm not sure why, but that seems to work, and it's a little less bulky as well. Things you do not need to bring: diaper and wipes for one, because the hospital will provide them. Abdominal binder, you can usually ask for one. I usually recommend it for C-sections. Pads and underwear, you can use your own if you want, but I'm like, hey, whatever we're giving you for free. Perineal medications, your hospital will usually give as well. And the breast pump. Now, normally I'll recommend a breast pump for 2 big reasons. One is for separation. If there's a separation, let's say you are in the NICU, and baby's in the NICU where mom is unable to breastfeed, then I'll say for separation, try to introduce a breast pump. If there's, let's say, the other reason is if the baby is not latching on for after 24 hours, the baby still has not been able to latch on. Sometimes I would introduce a breast pump just to increase the stimulation. However, more than that, what can help you more than anything is actually taking your hand and hand expressing with your hand. That actually is one of the best things you can do even before you have your baby. Another nursing secret is that you can hand express before you have your baby as well. The colostrum that you have before during pregnancy has very little differences to the colostrum that you'll have after your baby is born. So if you wanted, you can even fill out a few syringes with your own colostrum during pregnancy, and you can provide it to your baby afterwards. Now, the biggest thing to notice is I don't want you to be discouraged if you try to express and not much comes out. Your placenta releases this hormone, progesterone, which actually decreases your milk production during pregnancy. And then after your placenta leaves its body, it starts this whole lactation phase that's going to increase your milk supply and start your milk production. Normally that colostral phase is about 2 to 3 days. Then you'll have your mature milk normally comes in after about 3 days. The best way to initiate your milk supply is by frequent and effective nursing sessions. And then the more that you do that, the faster it will come in. Then I have a few more tips about labor. If you have the full class, you'll be able to see that. We also have admission to the hospital, you know, different things to expect with that. I want to talk about vaginal and cesarean birth next. I talk about both because sometimes you don't know what's going to happen. You know, you might be expecting vaginal delivery, you might end up with a C-section, vice versa. You might be expecting to have a C-section, come in labor, and oh, what do you know? I'm going to be able to have a vaginal delivery. So everybody is different, and I want to go over a little bit of everything. So first off, with a vaginal delivery is that you might tear a little bit after, and I want to go over the difference between an episiotomy and natural tearing. Now, episiotomy, the difference between that and natural tearing is that episiotomy is a surgical tear. It's normally a lot of a clearer incision. However, it does hurt a little bit more than natural tearing. Natural tearing, it's going to be a little bit more jagged, a little bit more ragged, and it takes a little bit longer to heal. However, those are usually a little less painful than an episiotomy. Natural tearing is normally 1, 2, 3, or 4 in categories. One is pretty much that it was not that much. 4 means that it pretty much goes all the way from the anus, all the way from the vaginal area, all the way through the anal sphincter and even the tissues underneath. If you can even have a labial tear, periurethral tear, even a few others. You can even have an episiotomy and still tear extra. So the choice is yours as to whether you want to have an episiotomy or natural tearing. There's benefits and negatives for each one. And in the end, it really is up to you to decide whichever one you would like. Of course, there's different ways to manage vaginal pain as you are delivering, and especially as you are in labor. There's always the more holistic ways, such as Lamaze, which is basically breathing, and you can even have different breathing exercises, such as breathing in 3, out 3, or in 5, out 5, having a focal point. You can even have hypnobirthing techniques, which is based on the fact of pretty much repetitive mantras and repetitive sayings that instill confidence in you. So hypnobirthing is basically thinking, I was made to do this, and having those mantras and repeating them throughout your pregnancy. You can even have acupuncture, which is not necessarily the little points that you drive inside, but sometimes that can even just be pressure points, such as the pressure point that is in here, or the pressure points that's in here. There's even different pressure points that are around your body that when you press on them, they increase the rate of your labor and they help to move the baby down. And I go over a lot of those with my live consultation classes. So if you wanted to do that as well, you can always email me and we can go over all of those. Now, after delivery, if you have any vaginal pain after delivery, you can try Tux, you can try Dermaplast spray, even a SIDS bath. You can see all of those on Amazon, and even in the hospital, they might give it as well. For C-sections, and there's more information on the class as well. For C-sections, so usually you'll come in, they try not to do inductions or scheduled C-sections before 39 weeks. If it is before that, it's usually for a reason, such as high blood pressure or some form of distress, and then they probably would do it a little bit sooner, but usually it's about 39 weeks. Now, during the surgery, what you'll see is you'll see doctors, you'll see nurses, you'll see scrubs techs, a little bit of everybody. You'll see doctors for the baby, you'll see doctors for the mommy. Usually there will be either a nurse practitioner or a pediatrician there for the baby as well, and there'll also be a nurse for each baby. That includes is if you are having twins, there'll probably be a nurse for each of those babies and a different warmer for each of those babies. You will enter into the OR. Some hospitals will even let you see what the OR looks ahead of time. Sometimes it decreases the stress and anxiety that you're feeling if you see what the OR looks like ahead of time. You'll be on the operating bed. There will be an anesthesiologist there who will be giving you the spinal, which is a little different than an epidural. Spinal lasts a little bit longer than an epidural will. The best secret with that is you just kind of hunch over and feel like you can even practice before time. Hunch over and kind of open your back and try to think of like a place in your mind or a focal point, try to breathe and have breathing exercises beforehand. That will definitely help with the anxiety that you might face as you're getting the spinal, and for epidurals as well. They will first, they'll obviously let you know everything that they're doing. They will have the incision, they will take the baby out. It takes a lot quicker, it's a lot quicker to take the baby out than to repair you. So keep that in mind. So they'll have the incision, they will take the baby out, they will show you the baby first. They might even put the baby skin to skin with you for a little bit. And as that is happening, they are repairing you. They'll put the baby to the warmer. Well, they will start some stimulation, make sure the baby's crying. They might even do some like syringes and suctioning. Usually sectioned babies tend to have a little bit more fluid in their system. And then after, usually you'll go to the recovery room where you'll be able to breastfeed your baby as soon as possible. You can even hand express, even in the recovery room. That helps for cesarean births, especially. Sometimes cesarean births, the initiation of that really productive milk supply takes a little bit longer. But if you hand express while you're in the recovery room, it will help to kind of make that process a little sooner so that you can initiate your milk supply quicker. Now, that was for vaginal and cesarean birth. We talked about prepping and pregnancy and all of that great stuff. And there's still a lot more stuff in this class here. Now I wanted to talk about postpartum care, and there's even additional videos inside my classes. Now, we talked about pregnancy. We finally had the baby, we had labor, or you even have a C-section, but now you're thinking to yourself, what do I expect after delivery? So I noticed that a lot of people don't really focus on postpartum care or what to expect after delivery. So that's why I want to go over it. First up is whether you have a C-section or a vaginal delivery, you might expect some shaking. Now, that's because of all of the fluid imbalance and all of the stuff that's going on. So if you have some shaking, you can try warm blankets, some skin to skin, nice calm environment, or even some music. Dad can always do skin to skin as well if you're not feeling up for it. Contractions after childbirth is normal too, especially because that uterus has to go back to its original position. So as that is happening, you might have some contractions in your uterus, especially when you're breastfeeding. When you're breastfeeding, that same oxytocin is being released. Therefore, you might notice some contractions in there. You can try Motrin, which is an anti-inflammatory. You can try heating pads, or you can even try regulated breathing exercises and things like that. Mood swings are common after as well. Try to keep your support system. Keep notice if your mood swings are baby blues or if they're going into postpartum depression. Period-like bleeding is also to be expected. So postpartum lochia should not last for more than a few weeks. If it does, definitely call your doctor. Now, I hear this all the time. What's the difference between postpartum hemorrhage and just normal lochia, which is the bleeding that you have after delivery? Now, if you saturate one pad in 1 hour, that's considered heavy bleeding. Or if you have a clot that comes out the size of your fist or like a golf ball, then you would definitely want to let your doctor know, let your nurses know, so that we can all come by and see what's going to happen. Now, the recovery process after you deliver, you're going to expect some fundal massage, and just to be real, it's not that comfortable. We'll come in, we will be checking your uterus, we'll make sure it's firm, that there's no bleeding, that there's no clots. We'll see to make sure that your bleeding doesn't have, if we press down, we want to make sure that there's not too much bleeding coming out, and we want to make sure that it gets less and less and less. You might notice some postpartum exams, some complete blood counts will be drawn on you. We want to make sure that your hemoglobin levels are not too low, that you didn't drop. Normal drop, here's a little nursing secret, is about 2 to 3 points after you have your baby. Normal blood loss after vaginal delivery is about 200 cc's up to even 500. After that is considered a hemorrhage. For C-section, it is about 500 up until 1,000. So it's quite a bit more if you have a C-section. Anything over 1,000 is considered a postpartum hemorrhage, whether it's a C-section or a vaginal delivery. Just also, this is not on this page, it's on another page, but just quick tips to recover quicker. Number one is try to get out of the bed as soon as you can. You know, try to walk around. It doesn't have to be like marathons, but try to walk as soon as you can. Try to stay active. 2 is you can try to drink as much water. So 1 is walk, 2 is drink water, 3 is pee. You know, if you can pee, let's say before you breastfeed your baby, try to pee a little bit, empty your bladder, wash your hands, breastfeed, drink a glass of water. That can be kind of your routine. So we talked about pregnancy. We talked about what to expect with your pregnancy, how to stay nice and comfortable during your pregnancy. We talked about the signs of labor, the stages of labor. We talked about what to expect when you're actually delivering, and we even talked about postpartum care. Now, the next part is taking care of your baby. Now, for bathing and newborn, and I have some videos here as well on the last section of this course, but just helpful tips is try to get everything ready beforehand before you start bathing your baby. Usually I like to have the tub, I like to have a little squirt bottle, I like to have the soap, I like to have 3 little washcloths, one for the dirty rinse, one for clean rinse, and then another one is dry for the head. Try to check the temperature beforehand. That's why I like the squirt bottle, because it's more regulated water temperature, so it's not like down the sink. Because another thing is, if you have the sink, you don't know the temperature and how quick it changes. So at least with a little squirt bottle, you can control the temperature a lot more. Always start with the clean parts in the tummy first. So you start with the clean parts of the body, and then you'll end with the dirty parts of the body. Then you'll end finally with the head with a clean washcloth. That's why I say you can have, 2 washcloths for rinsing, 1 washcloth for drying. So you're using kind of 1 washcloth for the body, you're using another washcloth for the pelvis area, or you can use that same one. Then you put that to the side and finally wrap the baby up and then do the head last. That's because they're losing all of that heat from the head, so that will keep the baby nice and warm. And then make sure the umbilical cord is clean and dry afterwards from the bath as well. And it should fall off in about a week or 2. For diaper changes, yet again, make sure that all of your supplies are next to you. You want to put the new diaper underneath the old one. And remember, the flaps go from the backside and then they make their way to the front. Use the old diaper to wipe a little bit off. Then you can use a clean wipe. For baby girls, always front to back. For baby boys, always remember to clean underneath the testes. Another huge tip is for baby boys, make sure that the penis is facing down, that it's not facing up. Because if it faces up, this is not necessarily a nursing secret as much of a mom hack, is if it faces up, it's gonna pee through all of your clothes and you're gonna end up having to change all of your clothes. And then, sometimes they poop and pee as you're changing. That's normal, it's gonna happen. And make sure all of your diaper changing supplies are next to you, because the last thing you want to do is leave your baby so that you can, get something else. My next section is for infant sleep. So sudden infant death syndrome is a really, really frightening syndrome, of course, for all parents. And it's so important to understand the risk of SIDS and how you should put your baby to sleep. So always put your baby to sleep on the back, okay? Alone in a nice hard surface. Try not to have too many blankets as well, because you want to prevent overheating. And then this is a diagram that shows the difference between putting them on the back to sleep and putting them on the stomach to sleep. So as you can see, if they're on the back and they were to spit up, by gravity, it would just go into the esophagus and into the stomach. Compared to if they were on the stomach, by gravity, it would go into the trachea and into the lungs. So that is why it's very dangerous to put a baby to sleep on the back. To put them to sleep on the stomach. I even have more safe sleep videos. There's even information about circumcision care, all of that good stuff. Now, another, so we talked about a lot. We pretty much went over pregnancy. We talked about labor and delivery. We talked about postpartum care, a little bit about newborn care. Now, as a little bonus, I did want to go a little bit over my breastfeeding class. So all that we went over here was my childbirth class, which if you go to courses, you'll see childbirth class. That's how you sign up for that one. And then when you do go to course login after you sign in, that is your student dashboard where you'll be able to have access to all of those online courses here. You'll be able to see the prenatal crash course, the childbirth mastery class. You'll be able to log in and keep track of all of that, great stuff from there. Now, another course that I have is the breastfeeding class. So this breastfeeding class is a class that I put together, and it is so in depth. It literally is Everything that I learned as a lactation nurse over 8 years of nursing experience, as well as my personal experience nursing 2 kids. It is so good. You probably can even take a lactation course and and pass it. Like that's how much information it has. It has breastfeeding basics, latching. It even has breastfeeding barriers, how to overcome common barriers, has pumping information, and all of that great stuff. So what I wanted to go over was just a little tidbit of my breastfeeding class as well for this, just so you have a little bit of everything. And the tidbit that I wanted to go over was breastfeeding positions and my top 5 breastfeeding positions. Now, I noticed that a lot of people, their most common breastfeeding issue is that they are not supporting their baby correctly, or that they're not positioning their baby correctly. Now, babies need to be well supported in order to breastfeed. If they are not well supported, they're going to end up kind of reaching up in the air and flailing about and freaking out, because their natural tendency is, if their bottom is not supported well, their natural tendency is, oh my goodness, I'm falling. And then they're going to start flailing around. That is why it is so important to know these breastfeeding positions so that you can adequately feed your newborn baby. Especially because if a good position means a good latch, and good latch means good milk transfer. So the first thing we have is cradle position. Cradle position is a little it's comfortable. This is with the cradle position where you kind of have the baby, and I'll move a little bit this way, where you kind of have the baby this way. Cradle position is very comfortable, but it is a little difficult to control because you're kind of going like this and trying to get the baby to figure out where the breast is. It is comfortable, but it's a little difficult to latch a newborn with this position. The next one's cross cradle, which I love. That's where you'll have the baby on this, pretty much controlled with your hand and your forearm, and then you will take your hand, cup it underneath like an underwire bra. You'll take your thumb over here and allow the baby to latch. All of these positions, you do not move at all. You move the baby up and over. So you will pretty much express a little bit of colostrum and bring the baby to the breast up and over. That is cross cradle position. You also have side lying. Side lying is where you will be able to lie on your side, have a little support for the baby behind. It's super comfortable. It's great to position the baby. It's even really good if you have an oversupply, but you can fall asleep very easily. So just make sure that you do it safely. Then there's the football hold. That is the football hold, is great for C-sections. With that one, you pretty much have the baby like a clutch over here. You'll have the baby here, you'll have your breast over here, and you bring the baby to the breast up and over. This is great for C-sections because it keeps the pressure off of your incision site so that the baby will be able to latch on without so much pressure on your incision. Baby led is where a position where the baby has control. You put the baby over you, they make their way to the breast. That is great for the development of the muscles, great for the development of the senses, but sometimes it can take a few tries, so it requires a lot of patience. So that was just a quick run through of my 5 nursing positions. So yet again, these online courses are available for you on my website. You just go to mommydidyouknow.com. Your course login page will have your dashboard with all of the courses, and the courses are here. I have free previews as well of the prenatal class, which is basically this class. You'll also have the breastfeeding class is this whole class that talks about latching, anatomical issues, engorgement, pumping. And I'm a pro pumper, by the way, because I pumped with both of my kids. I was able to breastfeed as well. I exclusively breastfed my last one, and I was able to breast, and I did a little formula with my first one. So of course, everybody's feeding choices are different. So I even go over formula feeding and bottle feeding in my breastfeeding class as well. And the childbirth class has a lot of wonderful information also about everything from pregnancy to preparing for your delivery, pain relief methods. And then another option, so these courses are my online self-paced classes. Those are classes in which you'll have complete access to 24/7. It also includes extra ebooks that you can have and downloadables to help support you on this process. The other option for you are consultations. So that's if, let's say, you wanted a little bit more than just a basic online class. Let's say you wanted me face to face for a personal and private class with you. If you wanted that, you can go to the consultations tab, has some frequently asked questions. I do prenatal consultations as well as postpartum consultations. So with that, good news is my consultations are covered by insurance. I will repeat that. Most insurances will cover at least most, if not all, of the fee of my consultations and private classes. So with that, you can choose, there's so many different ones. You can book online through here. And then it goes to this booking portal, or you can even call me. Sometimes it's better to call me so that we can come up with different packages that will help you individually. And yet again, these are covered by most insurance plans. You can just ask them if prenatal and lactation visits are covered, and then you can even book online, or you can even call me directly, and I would love to come up with a package that fits your needs. Usually my prenatal classes, if they're a private class, it will include both of my classes, the childbirth class, as well as the breastfeeding class. In addition, it can also include 2 hours private with me where you can discuss all of your questions and all of your needs all in the same place. You can even introduce different people. We can have different people all logged on at the same time that we all can learn together and support each other. If you have any questions at all, you can always send me an email, mommydidyouknow@gmail.com. You can also call me at 954-471-6934. That's 954-471-6934. We can come up with a plan that works for you. Let's say you say, okay, I want to sign up for the online classes now and maybe even have lactation consults after the baby's born. We can do that as well. So whatever you have, I will love to support you on that journey. And I hope that you have a wonderful rest of the day. And I really hope that this was a good benefit for you. You also can connect with me on my website. On the top right corner, it has all of my social media accounts. It has Facebook, Instagram, LinkedIn, YouTube, and I do have a whole bunch of YouTube videos, different playlists to help support you as well. Instagram has lots of daily tips for you about everything from newborn care, sleep training, baby care, Facebook as well, lots of blog content. So there's so many different resources out there for you in my website. And if you really enjoyed this, I would also love to hear from you. You can also just even send me a message at mommydidyouknow@gmail.com. You can say if you enjoyed this class, or even let's say you say, hey, Rachel, I love this class, but I would love to hear more about this. I would love to hear from you as well. I'm always looking for additional ways to support you. So I hope you had a wonderful, wonderful rest of the day. I wish you all the best of luck. I'm praying for you and your family, and I hope you have a wonderful rest of the day. Bye-bye.